Well, hey guys, welcome back to the vlog. I thought I would answer some more skincare questions that I noticed from you guys and some that I got over on my Instagram, just like I did last weekend. You all seem to enjoy that random Q&A. So one that I got over on Instagram, and I get questions similar to this a lot. I've used clindamycin phosphate prescription lotion for back acne for over 6 months now and have not seen any improvement. Any advice on what to do now? So I can't give anyone any specific advice on how to treat their acne or any skin condition, but I will say when it comes to stubborn acne on the body, it's really important, first of all, to follow up with the dermatologist who wrote the prescription. You can't just expect to give a prescription for acne and then not ever have any kind of a loop around. Did it work? Did it not work? So that would be like step number one. But as far as things for back acne, chest acne, body acne in general can be a lot trickier to treat. Clindamycin lotion alone doesn't surprise me. I would expect, however, that at least within 3, 4, even 6 months, you would at least start to expect to see some reduction in acne. Now, one thing about clindamycin, it's a topical antibiotic, and it also has anti-inflammatory properties. But an issue with topical clindamycin is that it's not really meant to be used indefinitely as a standalone acne treatment. Because it is an antibiotic, you can run into this issue of antimicrobial resistance. And I have a whole video actually on antimicrobial resistance. It's not that the acne becomes resistant to the drug, and it's not even necessarily that the acne causing bacteria that you have develop resistance to the drug, although that's certainly a possibility. The pressing issue is that bacteria in general will become resistant to the antibiotic clindamycin. So it's an antibiotic stewardship issue, and one way to reduce that risk is to combine clindamycin with benzoyl peroxide. That helps cut down on the risk of antimicrobial resistance emergence. So when it comes to treating body acne in general, benzoyl peroxide is a great topical. So the combination together can not only help cut down on the issue of antimicrobial resistance, benzoyl peroxide can actively treat the acne. It can complement the clindamycin. So together they're like a really nice duo. And you could use a benzoyl peroxide body wash. 10% might get you results faster than 4%, but maybe more drying. So that's kind of a way around that. Now, when it comes to body acne, there are many other prescription routes that you could go down. Now, the second question I want to talk about is, how do I make my scalp less greasy so that I can wash my hair less frequently? This is a very common question I get, is with regards to an oily scalp. So products will not address oil production. They won't. They will not tell your oil gland to put out less oil, whether it be in the scalp or on the face. You can remove oil with cleansing practices. You can absorb it and kind of dry it up, or what is on the surface, with clays, powders, aka dry shampoo, but you're not actually going to shut the oil gland up. So this is a situation where isotretinoin would work to cut down on scalp oil production. However, to go on isotretinoin Accutane for an oily scalp, you're not likely going to encounter a dermatologist champing at the bit to execute that treatment modality because, it's a little bit of the risk reward, but, some might, okay? Some are, so, some might. So you can definitely get a reduction in scalp oil that way. The other thing I tell people who have oily scalps is to not fear shampoos with sulfates, because they're very effective at removing sebum, and they're not necessarily overly drying to the scalp or to the hair. The other thing that people surprisingly find to work for reducing oiliness in the scalp is actually Botox. It's pursued for reducing sweat, and so oftentimes in the scalp, right? So they get a reduction in sweat, but it also seems to have some effect on sebum production and oiliness as well, likely related to the signaling at the level of the follicle. You know, you can use dry shampoo, right? Like if your hair is looking greasy and you need a quick fix, you can use dry shampoo. But I warn people about leaning into dry shampoo too heavily, because it will lead to a buildup on the scalp of that dry shampoo oily residue mixture. So, you know, it's kind of a delicate balance for sure. I see people putting micellar water in their scalp to cut down on oiliness. I can see how that would, you know, help cut down on oiliness a bit, but I can't say as I've ever tried that. All right, then here we go. We get a question on, can teens use glycolic acid? Short answer is yes, they can. Long answer is, I get a lot of these questions about teen and tween skincare. I think because so many tweens these days have gotten really, really into these over-the-top skincare routines using multiple different serums, actives, etc. And it gives everybody like pause, clutching pearls here, like, oh my gosh. I agree, it's a lot that they're doing all that, but you also have to take a step back and realize that some of these skincare products that you can get over the counter can offer some benefits for certain skin concerns that tweens and teens deal with. So they're not off the table. Like glycolic acid could be helpful for a tween who has got acne and it's healing with dark spots. It can also help cut down on comedone formation. Glycolic acid can also help to hydrate and gently exfoliate away rough and bumpy cheeks from keratosis pilaris. So it's not off the table for a young person. The problem lies in the fact that you have these young kids going on TikTok and getting all excited about skincare and getting these over-the-top elaborate routines, and they don't necessarily, in many cases, have the maturity level to execute them, you know, safely, and they end up using too much stuff that they don't really need, and they get a lot of irritation. All right, here's another one. Can Rogaine cause gray hair, and is there a way to stop it from causing gray hair? This is interesting because a lot of people do find that their hair, they notice gray hair when they start using Rogaine, minoxidil, topical minoxidil. And it's not actually clear if the minoxidil itself is causing the hair to gray, or if because it has put more hairs in the growing phase, you're just seeing more gray hair now, which seems more likely. While graying of the hair is the most common hair color change reported, they also note other changes like brown, the hair becoming more brown or more yellow. It could just be a guilty by association thing, because again, the way it works is to put more hairs into the active growing phase. So you might just be seeing more hairs now and they have this color, whereas they were not that way before. All right, speaking of Garnier Fructis, this is the one that I'm currently using, the Triple Nutrition. It's been amazing. But you see they have sodium lauryl sulfate, a sulfate. You know, there's a lot of phobia around sulfates and shampoos, but they can be really effective for removing that scalp oil. And a lot of people are really pleasantly surprised when they switch over. Like, I've heard a lot of people raving about the Sleek and Shine when they switch over to shampoos that have sulfates in them, because you have to keep in mind the overall formulation of the shampoo. It's not just the sulfate, it's balanced with other surfactants, other cleansing agents that are milder, as well as conditioning ingredients. I really want to try their Sleek and Shine Anti-Frizz Serum. I'm currently using that Virtue hair oil and I have been loving it. I highly recommend that. The other thing I was going to tell you guys is we have over here Head & Shoulders Classic Clean, because remember I was talking about the body acne. This, you know, it won't cure true acne, but it might help it a little bit by calming down the inflammation related to that Malassezia yeast, especially if you live in a hot tropical humid climate, because that little yeast really thrives in humidity and moisture, and it can create inflammation that might actually be an aggravating factor in your acne. So you could use zinc pyrithione, or you could also use selenium sulfide, which we have here. This is the CVS version of Selsun, but this is another option. This also, or the zinc pyrithione, either one, they also work well for tinea versicolor on the body. here we are, we have Minoxidil from hers, okay? So one of the things I wanted to say about Minoxidil, aside from that association with hair graying and changes in hair color, is that Minoxidil, the 2%, tends to be a bust, okay? Women can respond to the 2%, but just go with the 5%. Like, this is where the money's at, the 5%. Now, one thing about the 2% though, I will suggest, is that a lot of people want to experiment with using Minoxidil for brow growth. And you can do that. I think the 2% is a better option there because it's less likely to cause unwanted hair growth around the brow area, like in between your brows, because it is a lower percentage. You got to be real careful in getting it on there just right. But yeah, that is an option. One last thing about Minoxidil that surprises a lot of people. If you put it on your nails, it'll help them to grow because it helps improve circulation, which is a key driving factor in healthy nail growth. Like if you do these little nail tapping exercises, finger tapping exercises, it'll help your nails grow a little bit better. So yeah, wanted to say that. Biotin builder, on the other hand, is a pass, okay? You're not going to grow hair by taking a bunch of biotin. This also has gelatin in it, which I want to talk about because recently I did a video on collagen peptides. Collagen peptides are not the same as gelatin. Like, eating gelatin is not going to yield what taking collagen peptides are. This is the biggest mental block that people have to get over when it comes to any discourse around collagen, is they always interject, oh, just eat gelatin, or just eat animal protein, or just eat bone broth. Collagen peptides are specific fragments. If you eat those foods, you're not getting any appreciable amount of the actual collagen peptide. Okay, so it's not the same thing. It's not the same thing. They've even looked at bone broth specifically, has almost no collagen peptides in it. They're very specific fragments that when you take a supplement, which I'm not a fan of supplements, okay, I'm just telling you what we know about collagen peptides. When you take a supplement, that's what you're getting, those peptides. Whereas if you get a food, your body's going to break down that collagen in there, that protein, and it's the specific little peptides are not going to be released in any appreciable amount, okay? So it's like very little is what I'm saying. But this particular supplement has retinol palmitate, which you can easily reach toxicity with. You can easily overdo it with retinol palmitate, vitamin A. Dries out your skin and can contribute to hair breakage and hair loss. So that is something that, yeah, it can get you in trouble, and it takes a long time to clear it out of your system. You know, isotretinoin, we talk about whenever I bring it up, Accutane. It is, you can't take it if you're contemplating pregnancy or if you're pregnant, right? It's a teratogen. But the thing about isotretinoin is that the half-life is much shorter in comparison to supplemental vitamin A. Like the supplemental vitamin A, like that, can cause birth defects. And supplemental biotin can interfere with the accuracy of blood tests. Now, vitamin D, that's got vitamin D in it, low vitamin D is associated with hair loss as well. But not everyone who's having hair thinning or hair loss has low vitamin D. Now, I've also seen people singing the praises of the OGX anti-breakage serum, hydrating oil mist. Let me know if you guys have tried these. See, these are all silicone-based hair oils, which I really like. Ultra whipped egg white proteins. Okay, I don't know about that. Move over, Tim Burton, because pumpkin spice has me in a chokehold this year. I already told you guys, I admitted in the Fast Five, which if you missed it, what? Was Charlie being flippant? The Dove Cinnamon Pumpkin Pie Body Wash. This has been amazing. Scent profile, 10 out of 10. Scent experience, meaning not headache inducing, pleasant aroma to use, puts you in a good mood. That, well, when we were in Walmart together, I'm always seeing those Dove experiential body washes and being like, yeah, should I try it? Well, yeah, I finally caved. But you'll recall when we were in there together a while back, we saw a whole collection of seasonal soft soap hand soaps. Well, guess who ran out of hand soap? I did, in fact, restock with the soft soap pumpkin scent. Zero regrets here either. The hand soap, first of all, very gentle, nice lather, not drying, doesn't give me hangnails. Looking at you, Bath and Body Works, their foamy hand soaps always made me have hangnails. Anyway, this has been great. I've been using it now for over a week, and it's been wonderful. Once you rinse your hands of this, it doesn't leave behind any kind of strong scent, but it's really pleasant to use. Want to know how much this will set you back? Like $1.15? Yeah. That is one to get. Now, here is a mistake a lot of people make with stuff like this. You get down to the dregs and you think, oh, I'm just going to fill this up with water and voila, I'm going to get that out and have soap. No. I've done that. Okay, I've done that with shampoos and all sorts of things. Yeah, don't do that. The cosmetic chemist will warn you about that because it messes up the overall formulation and it's no longer functioning properly. So you're compromising effective hand washing when you do that. And cold and flu season, you don't want to mess around with that. So when push comes to shove, unscrew the cap, dump some out in your hand, and then whatever is stuck here at the bottom, let it go. Let it go. Just get a new bottle. Or they do sell refills of a lot of these scents, like big refills. So get that. Another issue that they warn you about with this kind of thing, and I get it because I've tried this before and it's always been like, it's not quite the same, is decanting products into a different container. It really can whack-a-doodle the whole formulation, not just because of like the air exposure issue kind of things that you might run into, but the materials that the container is coated with are key in formulation design and all these high-tech things. Okay, I'm not going to pretend to know all of the ins and outs, but I've heard them explain it eloquently. It makes perfect sense, and I've seen it in action. I don't like to get ripped off. I do my best to make stuff last. Anyways, guys, if you like this vlog, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.